This is the Healthcare IT Talks podcast. My name is Brian Green. I have a guest today, Sam Balga from ViewPoint at GE Healthcare. Before we get started, if you'd like to subscribe, we certainly invite you to do so. Click the button to subscribe to our podcast. You can get access to additional content. A few weeks ago, in one of my previous podcasts, I talked to Lee, who is a connectivity lead for point-of-care ultrasound, and we talked about the nuts and bolts of connecting ultrasound machines to the enterprise, and a little bit about the importance of storage for that data and how, the ultrasound manufacturers need a place to store that data, need a way to integrate to the electronic medical record system and the rest of the enterprise. This week, I wanted to talk to Sam, who works with GE Healthcare's ViewPoint team. And Sam, I'll let you introduce yourself. Go ahead and tell us a little bit about yourself.
Yeah, Brian, thanks for having me. So my name is Sam Balga. I'm the Vice President General Manager for the Ultrasound IT business here with GE Healthcare, supporting the US and Canada. Our primary solution is ViewPoint, which is the ultrasound software image management and reporting system for GE Healthcare. We're a vendor-agnostic solution that's been around since 2002. So we've been around for a while.
From my perspective, ViewPoint is one of many subspecialty PACS out there, right? ViewPoint happens to be a subspecialty PACS for OB, mostly for OB, right? We're talking about point of care here in this podcast, but OB is certainly a much bigger market for the ViewPoint product as a subspecialty PACS. And more we're seeing in the enterprise imaging space where we are supporting subspecialty PACS, where in a previous world, before we had ubiquitous VNA, something like ViewPoint would live in its own island, and it would be used by the clinicians in that particular department, and that's it, right? It was its own little island. And what I want to talk about is one of the goals for enterprise imaging is to try to expand access to the data that's acquired in these subspecialty PACS and stored in these subspecialty PACS and open it up to the rest of the clinical user base, right? And I'm hoping you can talk to me a little bit about that. Where do you guys in ViewPoint envision that trend? Do you see that? Number one, do you see that happening in any of your customers today, where they see a benefit to that of having, say, OB ultrasounds being available and to other clinicians outside of the OB department, and being able to leverage some of those enterprise tools? I think I threw a lot at you there, but
yeah, no, I got it. Absolutely. And that's where it's headed, right, Brian? I mean, when ViewPoint, as I mentioned earlier, we go across, I'll call it women's health, so maternal fetal medicine, OB. We're in cardiovascular, we're in radiology, and obviously in point of care, right? And we're ultrasound focused. So from a PACS perspective, that's data that that we are all capturing, whether it's in a format of we are that database, or whether it's a format where we're more that middle mini PACS that you were referring to. But in the end, it needs to end up in that location. And we have plenty of health systems coming to us right now and say, hey, can you integrate to the VNA, right? Because you have critical data that we need to make sure that we're dropping in that location. And that's what I mentioned earlier. Integration is a key part of this. When we talk about everybody that needs to be involved in that decision process, IT is obviously a big part of this discussion, right? The IT folks, because they obviously are looking for standardization. They're looking to minimize, essentially the solutions that are out there within their health system, but yet maximize how all the data is integrated. And that's where I'll call it the magic happens in being able to create that integration, into a platform like a VNA.
Yeah, and I think your product is also used by cardiologists to some extent too, right?
Correct.
Yeah. So it's not, you're in the radiology space, the cardiology space, fetal medicine, OB. Yep. And in all of those different areas of medicine, it's not just ultrasound that those clinicians care about, right? There are sometimes cases where they want to see other things, right? And your subspecialty PACS is focused on ultrasound. And in the enterprise imaging world, what we're seeing is that, in the old world, we're telling clinicians, you're going to use this package to look at ultrasound. You're going to use this other software to look at the EKGs. And you're going to look at this other software to go look at x-rays. And what we're trying to do in enterprise imaging is say, here's one place that you can go that you can see everything together in context. You're not going to be able to do your reporting there, right? We still want the users to go to ViewPoint to do their, their interpretation and their reporting. But when they want to see things in context across the, the enterprise, we want them to come to the enterprise imaging. And likewise, when they want to share their data outside of their department, right? They don't want people having to go into, and that's the question I wanted to ask you is, clinicians that don't specialize in OB or fetal medicine, if there's some data that they want to look at, it probably doesn't make a lot of sense for them to go to a ViewPoint workstation, for example, to look at that, right?
Correct. And even let me take a couple steps back, because the point that you made was very valid. When you look at all those segments that we just talked about, right, it is specialized, and that's where EMRs fall short, right? Because they don't have that level of capabilities that, say, a cardiologist is going to need in order to post-process raw data, right? For example. And so the ability for these specialty segments to be able to do that reporting, do it within, say, ViewPoint, right? But then get it all into that centralized location is critical to, again, all the modalities being viewed, right? Not just ultrasound.
Yeah. That's we're trying to think bigger, in the enterprise imaging as far as the diversity of data. But what we don't do well in enterprise imaging is those specific tools for the subspecialties. An example for me, I was talking to somebody in enterprise imaging that said, Brian, we're interested in going with a VNA, but I want to replace all of my subspecialty PACS with a VNA. So they were basically telling me, I want to replace my ViewPoint, my RAD PACS, my cardiology PACS, and all these other things with an enterprise imaging platform. And my response to that is that's not a good approach. There's a lot of things that something like ViewPoint does very well as a subspecialty PACS focused on that space that no one else is going to be able to do very well, right? That's my approach. So I think we're always going to live in this world where we have subspecialty PACS like ViewPoint that clinicians in the OB or fetal medicine or cardiology are going to use, right?
Yeah, Brian, there's a level of specialty, especially when you look at, I'll go across all the segments, including point of care, to radiology, to maternal fetal medicine, OB, to cardiology, right? I mean, there's a level of detail that's needed within the reporting and data capture that's not generic, right? I mean, it's just not, right? And so I think, and these physicians are very comfortable through their training, in working with that type of reporting and documenting correctly that way, that we have to be able to offer that. Otherwise, we'll fall short. And then you open up the umbrella from a billing perspective, right? And being able to make sure that you're capturing the appropriate data to be able to bill and be compliant. Yeah. So it's sort of a domino effect, right? That you have to be able to. It starts with giving the clinicians the tools to do that, that scan and that exam and that complete that report in a standardized, efficient, correct manner. And then from there, then again, it follows upstream to be able to make sure that that data is landing in the right location, including with the billing folks. So.
Yeah, it's just not feasible that you could have a single clinical platform that does everything, right? And to me, that's almost, that's kind of what Epic tries to do, or what Cerner tries to do in that EMR world. I think a lot of us remember when there used to be lots of different information systems in hospitals. You had a radiology information system, a cardiology information system, and now a lot of that's consolidated. And, Sam and I, we both live in an area with Wawa, right? And sometimes I think of this problem like Wawa because, I can go to Wawa's a local supermarket or a local convenience store, and they have everything you could possibly want there. You want a hoagie, you can go to Wawa. You want a hamburger, you can go to Wawa. You want a pizza, you can go to Wawa. But none of it's great. It's just if you got a group of 7 people and everybody wants a different kind of food, you can probably get what you want at Wawa, but nobody's going to really like it that much, right? Although some people swear by their coffee, right? And to me, that's kind of how I look at enterprise imaging and information systems is, we far too often we're trying to take things like enterprise imaging and turn it into a Wawa, turn it into a 7-Eleven. It's got a little bit of everything, but none of it's great. But when you have subspecialty PACS like ViewPoint, it's something that does a job very well that you simply can't do in an enterprise platform, right? You can't take, and there's a lot of things like ophthalmology has solutions like that. Dental has solutions like that. Sure, in enterprise imaging, we can view ophthalmology, we can view dental, we can view tomosynthesis, right? But we don't have a lot of these, the depth of these tools that those subspecialty systems might have.
And Brian, the other component is which is what we do day in and day out, right? Is making sure that we are providing the tools to those specialties that they actually need to continue to practice medicine as they need to, right? Whether it's maternal fetal medicine, making sure we're staying up to date on the reporting requirements, requirements coming from the ultrasound, right? And we're vendor agnostic, so that is just not only GE, right? That's every other vendor that's out there, right? And so then it's being able to make sure that we are staying up to date with the accreditation components, right? With the data that needs to get passed over because healthcare is changing, right? And so if you can imagine, how could you lay that on an EMR system to make sure that essentially that they're staying up to date with what's happening in maternal fetal medicine.
Yeah.
Right. The Zika virus, came out a number of years ago, right, where we were required to put an update out very quickly to make sure that our maternal fetal metaphysicians, could essentially, measure, the brain circumference, right?
Yeah, the brain. I remember that.
Yeah, exactly. Yeah. So, how you're going to put that on your EMR company? Probably not.
No, right? Exactly. Yeah, that's a great example,
so,
right? They're not going to spring on that in a couple of weeks, right?
Yeah, absolutely. So, and there's probably plenty of examples that I can give you across every single segment that we just talked about leading through the point of care, right?
Yeah.
That, you want to partner with a vendor and a solution that is that specialized to meet those type of needs.
And from our perspective in enterprise imaging is whatever subspecialty PACS you have, we want to make sure we can support that from the enterprise imaging platform, right? So we want to make sure we can support ViewPoint and whatever other subspecialty PACS exists in the hospital. We're never going to have I don't believe there's going to be a time when we have, one platform that does everything. I think that's foolish for us to think that that's the direction we can go. So integration becomes really important.
Yep.
I'm going to ask you now about integration from the perspective of enterprise imaging, and this is the part that if you don't have a good answer, we might edit it out, right? And that's okay.
I'll do my best.
When I say good answer, maybe ViewPoint's not the best example here, but I'm just going to candidly ask you, in your business, how familiar are you guys with enterprise imaging standards like IHE? Is that part of the vernacular in your space, or is that kind of arm's length away, IHE, which is, IHE is these profiles that tell us how to integrate with different systems throughout the healthcare enterprise. I'm just wondering if that's common in that subspecialty PACS area, or if that's kind of a foreign concept.
Yeah, it's ironic. It actually hasn't been that common to us until we've gotten more into point of care, right? Where we know IHE has those standards within point of care, and we appreciate that because when you actually look at those standards, we're actually following those today as a part of our integration process with ViewPoint. So maybe we were doing it by default and didn't realize it, right? But the visibility, and that's what the exciting thing is going on right now about point of care, right? I mean, there's been, for years, there's been this challenge, especially when you look at encounter-based workflow, right? In can you deliver a workflow that can meet those standards, right? That can essentially become the answer to a lot of what we talked about, right? In regards to, the type of data that needs to be captured, how it's captured, right? The from an IT perspective, that integration that needs to occur, based on the IHE standards. So to me, it's exciting that we're heading in that direction, and especially in point of care.
Yeah, one of the trends that we're starting to see in enterprise imaging is what people are trying to do is take these subspecialty PACS and focus them on what they're good at, which is providing clinical tools to their users, and take the shackles off of them for things like long-term storage and long-term data management. And one of the things that I've been asking subspecialty PACS vendors, whether at GE or other vendors, is is that something that's on the radar, right? Is being able to support a long-term archive or a VNA, which essentially can manage all that data. So in a future world, you know, there could be a future world where something like ViewPoint is providing the clinical tools, but is less focused on the long-term DynCom storage, right? And isn't worried about displaying that to everyone in the enterprise. Let the VNA handle that, right?
Absolutely. Yeah. And we would prefer that, quite frankly. Let us do what we do well and let the VNA do what it does well. And quite frankly, I think that's where we'd like to see it go too. And that's why for me, the situation right now in point of care is pretty exciting for us as a business. I mean, there's a definite gap in need as I go out and talk to customers weekly around the workflow requirements that need to be in place that aren't happening today. Everything from image capture to report and data capture to compliance, a lot of what we talked about, all builds into that workflow discussion that we're having, right? And the VNA brings that all together. We do our part, but the VNA brings that all together.
Yeah, and there's certainly there's a lot of these IHE profiles that can help us with that integration that are kind of future things that we'd like to see a lot of subspecialty PACS do. One of the challenges that we see with subspecialty PACS is change management, right? Somebody goes into the subspecialty PACS, pulls an image down, and maybe makes some change to that image, and that change has to be communicated back to the enterprise imaging platform. And there's standards that allow that to happen. And I think ViewPoint supports some of that, not all of that. So, our hope is that all subspecialty PACS will start to support all of those standards, right? So hopefully that's something that's on the roadmap for the future.
No, absolutely an area for development for us, and and to the point that I was making earlier, that's what's so exciting about what we're trying to get done in point of care is not just look at it very one-dimensionally. It's not just about image capture. I think we'll all agree, right? And point of care definitely is a broad stroke, right, across the health system. But especially in areas like the ED, in ICU and even CCU, where that level of reporting and data capture is pretty critical. The ability to demonstrate that complete circle of workflow, leading, having the VNA sort of be the gateway to manage all that is a critical part. And then we haven't even talked about meeting IT and security requirements. Right. Which, which is another component of it all too. So.
And those are more shackles that can come off on the subspecialty PACS that can be shifted to the enterprise imaging platform. It's built for security. It's built for compliance and governance and all that stuff. So it could certainly help. And one of the things about point of care ultrasound that's benefited me. Now you were mentioning all those things is I don't think I would have learned as much about OB and fetal medicine and how your product works if it weren't for point of care ultrasound. It really kind of got me more involved with what ViewPoint does and how it works. And, as my customers come to me and say, hey, we have ViewPoint, I now know more about that subspecialty than I did before. So point of care has certainly helped me in that respect.
Yeah. And as we have more and more discussions with our clinicians that we're partnering with, and they talk about the challenges that are going on out there right now. If you look at what the impact that COVID made in the past 12 months to how we approach healthcare, I think it created some, I'll call it some opportunities where the focus on what needs to be done in point of care from a standpoint of the clinicians, but also from a standpoint of IT's look at it, right? From a standpoint of risk management, from a standpoint of billing and reimbursement, there's just a lot of focus there in the area of point of care, where maybe historically there wasn't, quite frankly. And I think the impact on patients, the impact on how the clinicians need to make sure that they're capturing that data and documenting, to me, has come more to the forefront in the past 12 months.
Yeah,
and,
I think
and for me, our opportunity to be able to come in and understand the workflow, make sure we're understanding what their desired workflow is, because it's not cookie cutter, we all know that, right? But then being able to leverage this GE solution that includes the VNA, brings a full circle of workflow together for a customer that maybe they might not even have imagined that was available to them.
Yeah, what I got from that, Sam, is the COVID really put a lot of financial pressure on hospitals and health systems, and the tools that they're using for patient care in COVID. One of the important tools has been ultrasound, right? And so you kind of have these two competing pressures. You have this financial pressure to not invest in these clinical tools because we were financially pressed because of COVID, but we need those tools to diagnose and to treat our COVID patients. But what's helping with point of care, by having these workflows, we could be enabling hospitals to get some revenue, which they deserve, right, for using that equipment to fund the equipment they need to treat those patients, right?
Absolutely.
Which wouldn't be possible otherwise.
Yeah.
So
yeah.
it's an important
Absolutely.
part of it's an important part of that overall approach to COVID.
I can't tell you conversations that I've had with with some health systems that haven't been capturing that data, and a lot of it has really been driven by the exposure that COVID has brought, especially with patients flowing through the ED, right? Who are being asked to, the clinicians are being asked to do more ultrasounds, right? In those environments, whether they're for cardiac issues or whether they're for, general type of imaging issues, whatever that may be. Now the exposure is even higher, right? And so that's why, we want to try to make it simple, for the clinicians who really just want to do their job, but yet are being asked to create this level of documentation and be at a level of compliance based on the ultrasound scan that, that just needs to happen, that maybe historically, wasn't an area of focus.
Yeah, what you guys are doing is allowing that documentation to scale, right? Because without software solutions, doing all that documentation doesn't scale very well, right? It's too difficult.
Yeah, not the ask, if you're an emergency doctor, and I know I'm preaching to the choir to the folks that probably are listening here, you know what I mean, who are really just doing their job, right? If you're an emergency room physician, who really is in focus in taking care of that patient, but yet being asked to create a level of documentation off of a scan and make sure it gets to the right location, right? So they can bill appropriate. That just historically has not been an area of focus that at least we hear around. So.
Yeah, agreed. Thank you for joining me today, Sam.
Absolutely, Brian. Thanks for having me. I appreciate it.
All right. I appreciate you being on today.
Thank you.